Let's talk about factitious disorder, which is a different disorder. A 2-year-old girl was hospitalized after her mother complained that the girl had multiple episodes of apnea in the middle of the night. The mother was given an apnea monitor to take home, and when she returned, there were numerous episodes registering on the monitor. While in the hospital, the girl had no episodes of apnea. However, shortly after her mother's visits, there were numerous episodes recorded on the monitor. What we have here is a Munchausen's by proxy. This is the old name for factitious disorder. So factitious disorder is that patient who basically has the conscious production of their symptoms, either medical or mental. They know what they're doing, they're faking their signs and symptoms. This is the patient who basically will go to the doctor and say, "Doctor, I have fever, I have chills, I've noticed blood in my urine." When they give that patient a urine cup, that patient's going to go to the bathroom with a pin, stick the pin in her finger, put the blood in the cup. So when the sample comes back, there's blood in the urine. This is the patient that's going to complain of weakness, that's going to complain of diaphoresis. And when they check her glucose, the glucose is going to be extremely low. Why? Because she's injecting herself with insulin. So these are patients that will do whatever is necessary, no matter how atrocious it seems to us, because their goal is to get to the hospital. Their goal is to get attention. Their goal is to be nurtured. If the parent does it to the child, then that, of course, is Munchausen's by proxy. And in that case, what you saw was the mother faking these things for the child. So what the mother was probably doing was, when she was in the hospital, she was grabbing a pillow or something and smothering the child's face so the child would not breathe, so you would be recording these episodes of apnea on the monitor. As far as the risk factors and etiology, you tend to see more of these factitious disorders in men and in hospital and healthcare workers. Who better than us to fake signs and symptoms? And a lot of these individuals probably have histories of child abuse. So the theory is that they're going through life trying to seek attention. They're going through life trying to get help from people in the healthcare in order to relive that environment where they were taken care of and they were being nurtured by other individuals. Because of the multiple surgeries that a lot of these individuals might have, if you were to perform a physical exam, you might find what is called the gridiron abdomen. The typical scenario consists of the following. They do whatever is necessary to get into the hospital. Once they're in the hospital, pretty soon the staff is aware of what's happening. When these patients are either A, confronted, or B, are about to be confronted, how do you think they react? They're going to react with rage. How dare you accuse me of such a horrible thing? I don't need this kind of treatment, and off they go, and basically where they go is to another hospital. And pretty soon everyone becomes aware of these patients, so they end up moving to another community. So the treatment is more management than anything else. Now, if we look at the differential diagnoses from a psychiatric point of view, these are patients who, of course, can have other somatoform disorders. They can have personality disorders. They could also have substance abuse, be malingerers, or have Ganser syndrome, which is something that you find in prisoners, which is a near-miss answer. So if you ask the prisoner, what's the color of the sky? They'll say red. It's a color, but they'll give you the wrong color. Now let's compare somatoform versus factitious disorder. If we go back to this same table, looking at symptom production and symptom motivation, what do we find? We find that patients who have somatoform disorders are purely unconscious. As far as factitious disorder is concerned, with symptom production, they know that they're faking their symptoms. So therefore, that is conscious. However, they don't know why. And that is why therapy is essential, to help them understand the why of their behavior. If you can understand the why, then hopefully you will understand the behavior and they will be able to stop it. So there is some conscious component of patients who have factitious disorder.